Hello everybody and welcome to the Thursday edition of Video Clips. The incidence of many types of cancer is increasing and diagnostic testing is finding cancers at earlier and earlier stages, yet the death rate for most cancers isn't decreasing. One of the reasons is that we're actually experiencing an epidemic of diagnoses, not an epidemic of cancer. I'll explain that. This is particularly true of thyroid cancer. Increases in examinations, imaging, and biopsy have resulted in a significant increase in the number of diagnoses of what we call thyroid cancer, about 37,000 cases per year. Now, in spite of this increase in early diagnosis, there has been no decrease in thyroid cancer deaths, which have not changed and remained steady at about 1,600 cases per year. As a result of this and other studies, several years ago, the U.S. Preventive Services Task Force recommended against population screening for thyroid cancer. Now, for a long time, this is just one example of a much bigger problem. Doctors and researchers have been saying it is time to reclassify some conditions like certain thyroid abnormalities, lesions in the breast like ductal carcinoma in situ, and lung and prostate abnormalities, and just stop calling them cancer. Well, unfortunately, we've been going in the wrong direction for a long time. It's getting worse instead of better, according to Dr. Otis Brawley, Chief Medical Officer at the American Cancer Society. He says tiny lumps in the breast are referred to as stage 0 cancer. Small prostate lesions are called prostate cancer. And the problem is that as imaging becomes more and more sophisticated, which on the surface sounds like it would be a great idea, more of these tiny lesions are being discovered, and in spite of evidence to the contrary, increasing numbers of people are being labeled as cancer patients who don't really have cancer. Now, part of the reason this goes on, I hate to sound like the ultimate and continuous cynic, but it's wonderful for business. You take healthy people, turn them into sick patients, and treat the heck out of them, and it generates a lot of money. Well, it finally looks like some progress is being made to reduce the overdiagnosis of cancer. A type of thyroid tumor called, now get this, I'm not going to ask you to ever remember or repeat this, encapsulated follicular variant of papillary thyroid carcinoma, is that a mouthful? Has been renamed, and we don't refer to it as cancer anymore. Treatment for patients with this cancer, because it really isn't, has historically included thyroid removal, radioactive iodine, and regular exams for life, all of which it turns out were over-treatment. It's estimated that about 10,000 of the 65,000 patients diagnosed with thyroid cancer in the United States every year actually did not have cancer, but instead had a small mass in the thyroid, which is contained and surrounded by a capsule of fibrous tissue. It looks like cancer and that it's an abnormal growth, but the cells haven't migrated out of their capsule. Aggressive treatment with radioactive iodine and removing the thyroid is ridiculous over-treatment for such a condition. It's harmful to patients. The tumor has been renamed, and instead of calling it that big long name I used before, it's now called, and this isn't a whole lot better, but at least there's an acronym, non-invasive follicular thyroid neoplasm with papillary-like nuclear features. How about that? And the acronym is NIFT. All right. The term carcinoma has been eliminated, which is a good thing because the word cancer terrifies patients, and a cancer diagnosis motivates doctors to do aggressive things, and then terrified patients are inclined to do what their expert doctors say when they're given a diagnosis of cancer. Well, it's an interesting story how this came about. Efforts to reclassify this particular abnormality began with a guy named Dr. Yuri E. Nikiforov. He's vice chairman of the pathology department at the University of Pittsburgh. He observed that pathologists started calling almost all non-invasive tumors as cancer in response to the rare case in which the cells actually do migrate out of that fibrous capsule and turn into an actual case of cancer. Now, as is often the case in medicine, the tendency is to overreact, try to prevent all cancers and all disease, and so they overdiagnose and they overtreat. In this case, doctors started treating any abnormal mass in the thyroid as cancer and then aggressively going after it. Well, Nikiforov, I think is how you pronounce it, decided to do something about it. He watched a surgeon remove a thyroid gland from a patient who didn't have cancer and added follow-up treatment with radioactive iodine, and the surgeon, when he confronted her, defended the practice by saying it's what the guidelines say to do. So Nikiforov led a panel of experts who reviewed a couple hundred cases, and they found that for people whose tumors stayed put, no cells migrated out at 10 years, nobody had cancer. The small number of patients who had cells migrate out actually had cancer. And so the presence of invasion of those cells, or migration out of those cells outside the capsule, that's what defines cancer, not the presence of that little abnormality itself. The hardest part of the project, the doctors say, was choosing a name for the tumor. 10 names were considered, and they picked the one that they picked because of the acronym. It would be easy to remember. The panel submitted an editorial to the journal Thyroid advising that doctors who treat patients with these tumors as cancer patients may be violating the principles of first do no harm. The doc at the University of Pittsburgh and his colleagues in the meantime are contacting patients of the University of Pittsburgh Medical Center to tell them that they never had cancer and annual exams for follow-up are no longer necessary. He thinks that there have been 50 to 100 such cases every year for a very long time, quite a sizable group who will no longer be labeled as cancer patients. And he says that informing these patients is a moral obligation of doctors. And doctors who are willing to admit that they're wrong have a special place in my heart. So congratulations to this guy. Now we got to get the breast cancer guys and the prostate cancer docs and all kinds of other practice groups involved in doing the same thing. All right, we'll finish up the week with a story that I really like for obvious reasons when you hear it. High carbohydrate diets are more effective for weight loss for a variety of reasons. And here's the thing, the calorie dilute nature of most of the foods, their fiber content leads to a feeling of fullness with fewer calories consumed. And a new study confirms that high carbohydrate diets work better than a high fat diet for both a feeling of fullness and for reducing the desire to eat high fat foods. So the researchers enrolled 65 overweight and obese people in a study to look at satiety and the sensations that the participants associated with consuming certain foods. We call that hedonics in the research field. The subjects participated in different test meal days and were randomized to consume high-fat, low-carbohydrate foods or low-fat, high-carbohydrate foods. Participants reported feeling more full after consuming the low-fat, high-carbohydrate meals, despite the fact that the calorie intake was lower. Just as important, eating high-carbohydrate foods reduced the desire for higher-fat, low-carbohydrate foods. The high-fat meal had exact opposite. It took more food for the subjects to feel full, and the more they ate, the more high-fat, low-carbohydrate foods they wanted to eat. So the researchers concluded that high-carbohydrate, low-fat foods promote better short-term appetite control than high-fat, low-carbohydrate foods. Now, lots of studies have looked at the macronutrient value of various diet plans to determine which is better, and a lot of them reinforce the findings of this study. For example, research shows that the weight or volume of food determines the level of satiety, and people seek to consume a constant weight and volume of food regardless of the calorie content. So when you eat a high carbohydrate, low fat, plant-based diet, you can consume the same amount or an even greater amount of food while calorie intake goes down. Most people find that attractive. I know I'd much rather eat as much as I want of foods that are on plan than try to restrict and control. While portion control is often part of weight loss programs, several studies have shown that a better option is to decrease the calorie density of the food eaten rather than reducing portion size, and that foods like fruit, vegetables, and soups lead to satiety while reducing calorie intake. Research also shows that showing people how to eat lower calorie foods leads to more weight loss than showing people how to restrict their portions of higher fat, more calorie dense foods. Studies clearly show that when you eat a lot of calorie dense foods like fats and oils, for example, you end up gaining weight. It's not hard to imagine. I've often used this example. If I were to add an oil-based salad dressing to my salad one time a day and do it every single day for a year without changing anything else, I'd weigh 37 more pounds next year on this day than I do now. So trying to restrict intake of foods that are that calorie dense, very difficult strategy. Eating more calorie dilute food is proven to be a better long-term strategy. Remember, the study that I started with was a short-term study. In one clinical trial, obese women were divided into two groups. One group was told to eat a diet with large portions of calorie dilute foods like fruit, vegetables, and broth-based soups, and also to prepare foods with less fat. A control group was told to limit portion sizes and try to control fat intake. At the end of 6 months, the low-fat plant eaters had increased their intake of fruit and vegetables and lost 40% more weight than the control group. The researchers concluded that showing people how to eat more generous portions of the right foods was easier than teaching them how to restrict and eat smaller portions of the wrong foods. They further stated that this approach would allow people to eat the amount of food that they're accustomed to eating, going back to that volume issue that has been identified as very important. And feeling full would reduce the sense of deprivation that a lot of people experience when they're dieting. So the bottom line is the eating plan we teach here, better for weight loss. It is easier to lose weight when you are eating food that is not so calorie dense. I mean, it's just, at some point in time, this really is, to a certain extent, a math issue. All right, so that is all for today and for the week. So as usual, pass this on to anybody who you think might enjoy watching it, and I'll be back to you next week with more news.